noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious minds.
As you can see from the simulation, the continuous flow pump maintains stability even at high velocity. Yeah. What about the shear stress at this juncture?
Historically, the primary driver for mechanical circulatory support was the stark imbalance between patients suffering from terminal heart failure and the scarce supply of viable donor organs. Although they successfully maintained physiological pulsatility, positive displacement pumps presented significant engineering liabilities. The repetitive physical deformation. By replacing volume displacement chambers with continuous, high-speed spinning impellers, researchers simplified device architecture and eliminated points of high mechanical wear.
With an LVAD, we support this area, but a TAH, a total artificial heart, completely replaces the ventricles, as you can see here.
The machine seems to be working well.
It is. The numbers are exactly where we want them to be.
The internal mechanics of continuous flow rotary pumps are divided into axial and centrifugal configurations. Axial pumps drive blood parallel to the axis of rotation.
To eliminate the bearing wear that plagued early pumps, third-generation devices utilize magnetic levitation technology, suspending the rotor contactlessly for frictionless rotation.
The dual axial pumps are stable. We have a continuous flow.
Confirmed. Pressures look good?
I feel surprisingly peaceful, despite all the commotion. It's good to see you resting comfortably, Mom.
Your recovery is progressing remarkably well. The scans look clear.
So when can we expect him to be discharged?
If he continues at this rate, perhaps by the end of the week.
The patient survived for 5 weeks with the continuous flow system operating as designed. The pump sustains systemic perfusion, but is pre-existing.
Continuous flow circulation causes this vibration, which we call arterial shear stress. This triggers systemic pathophysiological adaptations throughout the body.
The hyperadrenergic state causes increased pressure within the carotid sinus, leading to noticeable vessel stretching, as demonstrated by the EEP and SHE formulas. In a healthy, pulsatile cardiovascular system, the surplus hemodynamic energy generated by cyclic pressure swings keeps The central nervous system interprets this reduced baroreceptor firing as a state of profound systemic hypotension. The primary hematological complication of continuous flow mechanical circulatory support is acquired von Willebrand syndrome.
I've plated the controls in rows A and B.
Okay, I'm labeling the treatment group now.
The formation of these vascular lesions is driven by a complex cascade involving physical forces and angiogenetic signaling pathways. The loss of pulsatile stretch downregulates endothelial nitric oxide synthase and induces localized tissue hypoxia in peripheral capillary beds. Without the stabilizing signal of ANG1, and in the presence of elevated VEGF, endothelial cells undergo dysregulated, hyperangiogenic proliferation.
The primary concern is managing his volume status while maintaining adequate flow. We need to monitor the parameters closely.
Should we adjust the diuretic?
Does this wireframe accurately reflect the flow dynamics?
We cross-reference the simulation data. It's within the acceptable parameters. Computational fluid dynamics modeling of this cycle demonstrates that this rapid change in impeller speed alters the local velocity gradients and shear patterns within the pump chamber. The aorta acts as a low-pass filter, dampening the sharp incoming pulse waves, which are then smoothed out before reaching the peripheral capillaries. The external charging unit sends energy through the skin, eliminating the need for a driveline and powering the internal system wirelessly. To transmit power efficiently, the primary side circuitry generates a high-frequency alternating current, typically at a resonant frequency of 150 kHz. By integrating feedback controllers that dynamically adjust the resonant frequency and system impedance, these systems can maintain a stable output voltage. Integrating wireless transcutaneous energy transfer systems to eliminate percutaneous connections and mitigate the risk of driveline infections.
Noir plasma chrome bleed. Unlocking knowledge, inspiring innovation, empowering curious mind.